Before we begin, I'd like to introduce the Premier Stephen McNeil and our Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy. Before I turn it over to Dr. Strang to give an update on COVID-19 for today, I just want to acknowledge the fact that we've had our fourth death in Nova Scotia, and I want to, on behalf of all Nova Scotians, pass on our deepest sympathies and condolences to the family and let them know that they are in our thoughts and in our prayers. Dr. Strang.
Thank you, Premier. And I, too, would like to pass along condolences and sympathies to the family. The deceased is a woman in her 80s in Cape Breton, and like all the other deaths, that is the level of information that we will provide publicly. Again, it is tragic, and it really points out the serious nature of this virus. And again, to the family, certainly dealing with a death at any time is hard, but especially at a time in COVID where we're asking families not to be together. So my sympathies again to them. In terms of our regular case update, we're announcing 27 new cases of COVID-19, which brings us to a total of confirmed cases in Nova Scotia to 606. Currently, we have 11 individuals in hospital. 5 of those are in the ICU. We have 177 people now who can be considered to be recovered from their COVID-19 infection. We have tested 19,506 Nova Scotians and who have come back negative. And in the last 24 hours, yet again, our lab, outstanding work, they processed 966 tests. As I mentioned yesterday, we started reporting the number of cases of COVID-19 in our licensed long-term care homes. I was incorrect yesterday when I said they're from all of continuing care. I was reading my notes wrong. My apologies on that, but the numbers we report are from long-term care only. And we're still refining that process. Some of the numbers coming in from facilities change over time. So if people are seeing some inconsistencies as we refine this process, we apologize for that. But there's also time lags and reporting from different agencies as well. But as of today, we now have 8 licensed facilities, long-term care facilities with COVID-19, being identified in them, and that involves in total 55 residents and 43 staff. We continue to support all our long-term care facilities, and especially those that may be in outbreak situations. As we close another week, now into mid-April, I just want to take a couple of minutes to look back of our collective journey. Unfortunately, we're doing it, but our collective journey with this virus, unwanted as it is. As a province and a healthcare system, we have been monitoring and preparing for COVID-19 since January. That's when we began to have, in public health, regular phone calls of chief MOHs across the country and our federal colleagues understanding what was happening first in China. We began asking international travelers to self-isolate as they came into our province in early February, and we, as the virus evolved, spread beyond China, we evolved our screening protocols to match that international situation as well. It was March 15th that Nova Scotia confirmed its first case of COVID-19. We had the fortune, I guess, of being the last province with in the country that had a confirmed case. We're lucky in that. It meant that we could learn from our other provinces who were earlier on in this. It also meant that we were able to implement the strong measures to shut things down much earlier in our outbreak, if you will, here in this province, as opposed to some other provinces. So we closed bars and restaurants, put limits on gathering, asked people to stay home at a point when we had less than 10 cases in the province. So we're seeing some of the benefits of that early action as we this week, as we presented some of the modeling, where we're tracking in a place below what the modeling would project we may be. We've continued to work to make major shifts in our healthcare system and our education systems to ensure people, as much as possible, are being kept safe. We're keeping people at home as much as possible, but still having the necessary access to virtual learning and to, in many ways, into healthcare. Often that's virtual as well for people. March 22nd, we declared a state of emergency, and we enhanced, necessarily so, the restrictions that we put on everybody's day-to-day lives. As we've done this, our testing capabilities and our approaches by public health in terms of case contact and follow-up have evolved. We are now, as I said earlier this week, we're second in the country, just behind Alberta, in terms of per capita testing, and that's very important. All the evidence says that aggressive, wide testing is a key component of getting ahead of this disease. And what needs to happen to that, and what we're doing is then that testing is combined with strong public health measures by the public, as well as aggressive and timely follow-up of cases and their close contacts by public health, which is exactly what we're doing. I do want to give a shout out to my public health colleagues. They are close to my heart. I worked with them for 20 years. Often public health goes unrecognized. I know they're stretched right now to all the work, and people are working very long days. They're not seen, but they're doing tremendous work, and I thank all of my public health colleagues for that. We are in a situation, as we presented with our modeling, that while the virus continues to grow, we're in a situation where we're able to handle that. Our health system is not being overwhelmed, and if we can keep doing the things that we're doing, we should be able to stay within that situation. But it's only that really is a result of the efforts that every Nova Scotian has done to allow us to be in that place. I fully acknowledge how difficult it is for people, for families. We put a lot of restrictions on people. Businesses, families are all feeling the impact of this, and I want to thank everybody for doing this. But we just need to point to the fact that we're doing this to ultimately together to save lives. Unfortunately, we've had 4 Nova Scotians who have died. We have several others who are in intensive care units. But I hope everybody can understand that the sacrifices we're all making is helping other Nova Scotians to be alive today, other Nova Scotians from not having to become severely ill and perhaps be in an intensive care unit. We are supporting each other by doing what we're doing. We do need to recognize that we're not out of this yet. We have some weeks of this to come that we need to maintain our strong approaches. But I hope as I talked about last week, there are ways that we are perhaps changing. We're becoming different, but there may be opportunities within all of that. We've found new ways in our communities to support one another, new ways within our families. And so while we're in the middle of some of these difficult situations, we have to recognize that we are being able to avoid some of the more severe challenges that if you look in either other provinces and certainly in other countries, and so I think we need to step back for a minute and look at each other and say thank you to each other, because it's because of the burdens we've been willing to take on and the ways we've been able to support each other even through this that we're able to and continuing to do this in the next few weeks is what's going to allow us to come out of this with minimizing the impact on the health impacts from this. It's also what will allow us to get out of this as soon as possible. I'll end up by saying, again, repeating my thanks to everybody. Appreciate that as the days and weeks go on, that what may have, that this becomes even more challenging as we move into our fifth and sixth week and have 6 weeks and have a few more weeks ahead. But again, if we can all stick with this together, we're supporting each other, minimizing the impacts on our communities, and it will allow us to get out of this as soon as we can. I'm starting to turn my mind. I've had discussions within public health. What are the things we start to do in the next few weeks that we can start to plan out how we might be able to loosen things up, and if we're successful, and in somewhat with luck, but also some of this is in all of our hands. If we all stick with what we need to do for the next few weeks, we're potentially in a position. We're coming into May and into June. We can start to loosen things up slowly and progressively. But we want to be able to do that. And as we get into summer, hopefully we can start to have a bit of more of a normal life as we move into summer weather. But again, I'll just end up by saying thank you to everything that Nova Scotians have given up. Thank you for your sacrifices. It's not unrecognized, but I ask people to stick with us for the next few weeks. Let's stick together, and we will come out of this as I said last week, different. But there may be ways we can come out of this better.
Thank you, Dr. Strang, and to all of you. Even though public health has turned their mind to what may look like loosening restrictions, he does not mean this weekend or in the week ahead of us. It's be weeks to come, but we are looking at that. And in the spirit, I'd also like to thank the small but mighty staff that is still here with me. Many of my colleagues are home. I want to thank my MLAs who are across the province who have continued to make sure their constituents are heard, and all MLAs. I want to acknowledge the men and women who are with me on the 7th floor who have done yeoman service. I don't know if they thought we would be doing this for 5 weeks, but we will not only be doing it for 5, we'll be doing it for many more. But Nova Scotians are indebted to you for the effort that you put in to support me and Dr. Strang. So with that, we will open up to questions.
Just a reminder that each reporter will receive one question and one follow-up. We'll start today with Mike Gorman with CBC.
Hi, thanks. Premier, it's been several days now since the Prime Minister announced that the federal government would help provide pay top-ups for essential service workers if the provinces partnered with them on that initiative. And so I'm wondering if you've made a decision yet about whether or not Nova Scotia is going to do this, and if so, what workers would that apply to?
Well, there are details that are still missing in that. Many people looked at that, thought it was the healthcare sector. The vast majority of healthcare sectors wouldn't be impacted by that proposal at all. My message to the national government was if they want to continue to contribute and send money to Nova Scotian families, they can do so. We are focused to work with those families who are not only currently working, but those whose jobs have been lost, and how do we best impact those families. It's obviously I can't do income replacement, but what we're hoping to do is to be able to ensure that they can afford to buy groceries and look after themselves until we find our way through this pandemic.
Mike, do you have a follow-up?
Yeah, thanks. Respectfully, Premier, it sounds to me that what you're saying is that although the feds are making this offer, it's not one that, at least in Nova Scotia, that we're considering.
We look at every offer the federal government makes. The federal government has the capacity and the ability to, if they want to support Nova Scotians or other Canadians. It's different from one end of the country to the other. But I made it very clear, we as a province are focused and continue to work on how do we best supplement the programs that have come out nationally, but make sure that those who have fallen through the cracks. As I've said at the very beginning, there are people who have lost their jobs. We need to make sure that we provide those families. That's why the emergency grant program we brought, an emergency workers grant program, we came in 1,800 Nova Scotians have received funding through that. It's why we continue to work with small businesses to make sure that they're viable here as we find our way through this pandemic, and we'll do that in collaboration with our partners.
Next question will go to Alexa McLean with Global.
Good afternoon. I'm just wondering what the follow-up is from the conversation with Prime Minister Trudeau last night regarding long-term care facilities across the country. Premier, could you touch on what was discussed and what challenges you raised, if any?
So I obviously raised the issue. I was pleased to hear the national government talk about the rent deferral program they brought in yesterday. We need to know how that fits inside of the one in Nova Scotia. There's still details vacant from that. To the previous question, we discussed the issue of top-ups. I encourage the national government, if they want to top up wages of Nova Scotia workers, they could do so. We are focused on how do we support those who have no income, whose families have been fallen through the cracks, and how can we best support them, and how can we best ensure that we have an economy and businesses that will be able to start up, when we find our way through this pandemic. And I was clear about the fact that while we're hearing in some parts of the country about the economy starting up, we're going to follow the advice of public health, and we have turned our mind to what that looks like, but we will be following the advice of public health when it comes to how do we open up the economy and loosen the restrictions that are now on the people of Nova Scotia.
Alexa, do you have a follow-up?
Thank you, Dr. Strang. I heard you mention that the numbers for the long-term care infections, they actually don't include all of the continuing care sector. So with that being said, I'm wondering where that leaves tracking for home care. This is an area that we've heard lots of concern over. I know it's a part of the continuing care scope, but I'm wondering, are cases of infections in home care being tracked specifically? Do we as a province know where those cases are?
So we're looking at, we do, we certainly have had workers in the home care sector who we know are cases, and we've followed all of those up. Some of it is just the challenge in a fairly diverse sector of organizing, getting all that information collated and collected so we can, bring it forward with a provincial number like we're doing for long-term care facilities. But we're looking at that. I'm always cognizant about we don't want to present numbers that aren't as representative as we can of a sector, and it's just there's many organizations and how they report numbers and trying to organize all that.
Next question will go to CTV's Natasha Pace.
Thank you. Dr. Strang, I'm wondering if you could provide a little bit more information about the woman who passed away, the most recent individual who passed away. The other people who died as a result of COVID-19, you mentioned a little bit more information, whether or not they had underlying medical conditions, if they passed away at hospital. Is there any more detail you could provide us with today?
I think the information, there's certainly this individual also had underlying health conditions. That's exactly the type of information I provided in all the other cases. We've given a gender, an age range, a broad area of the province of where they live, and a statement on underlying health conditions. And so that's consistent with everything we've said for the other cases.
Natasha, do you have a follow-up?
I do, thank you. My next question would be for either Dr. Strang or the Premier. I've been speaking with a lot of families who have loved ones at Northwood, and they say staffing is a huge issue right now at the facility, and that there's less than half the staff that are usually on. Northwood hasn't confirmed this yet at this point, but I'm wondering whether or not the government has been asked to step in and help. I know some family members say they've written to the Premier about this, and they're wondering whether or not there's anything that public health or the Nova Scotia government can do to help out with the staffing situation at Northwood.
So the short answer is yes. I just spent the last hour on a conference call with folks from Northwood, from Department of Health and Wellness, the Nova Scotia Health Authority, understand the situation, what their plans are, and they're absolutely will be moving forward very quickly, a plan to support them with the necessary staffing or to address the necessary staffing challenges and needs that they have in front of them.
They were given the direction to wrap their arms around Northwood. Whatever support and supplies that we have, we will provide to ensure that not only that we provide the appropriate staff, but that we ensure that those residents are kept safe, and we'll support those that are currently dealing with the issue of COVID-19 and as those recover, we'll continue to support them. But this is, quite frankly, as I said yesterday, this situation is the one that keeps me awake. We all hear of this virus getting into long-term care facilities. Many of our loved ones who are in these facilities have other underlying health issues. We will aggressively go after this virus inside of this facility, just as we have in this province.
Next question will go to Michael McDonald with the Canadian Press.
Thank you. Premier, the Mayor of Halifax has said that the provinces should ask the federal government to increase the federal gas tax to help municipalities with their funding shortfalls. Have you contemplated doing that? Should the provinces ask for an increase?
So the Minister Porter's been working with all of our municipalities across the province. My understanding, there was a meeting recently. There will be an ask coming into me, recommendations, and that may be one of them, and we'll look at them all.
Michael, do you have a follow-up?
Yes, for Dr. Strang. We just heard from health officials in New Brunswick that there were plans to loosen some restrictions that have been put in place as a result of the pandemic as of May 1st. Will that happen in Nova Scotia as well?
So I don't know what New Brunswick is talking about. I think our answer would be we don't have a timeline for a plan. We need to start looking at this, but there are a number of things that we have closed down, schools, campgrounds, etc. Until up until including May 1st. We need to look at that in the next week or so and make some decisions. But there's no commitment at all that we're going to open things up on a definitive date. It's something that we're as I said earlier today, we're starting to pay attention to that. But I think the message needs to be that we need to have several more weeks of really of strong restrictions before we can start to consider loosening things up. At this point, we're not going to commit to any timeline on anything. How our epidemiology, how the spread of the disease happens over the next few weeks will guide certainly the decisions, the recommendations that I will put forward to the Premier to consider.
Next question will go to Olivier with Radio Canada.
Yes, my question was for Dr. Strang. Dr. Strang, as the virus is continuing to grow in the long-term care houses, some people are getting anxious. Can you tell me or remember me what's the protocol when either a staff member or a resident of those facilities test positive? Do you ask the management of these facilities to inform the other residents and their family members?
Yeah, part of our directive to long-term care facilities now around COVID-19 includes guidance around their communication, how they're going to communicate to staff and families. It's part of what their normal business, what they do all the time, any events happening in the facility, and they will continue to work with them about what gets communicated to the broader public. But yes, there is a robust communication plan. Staff and families have certainly a need and a right to know what's happening in a facility where one of their loved ones is at or where they're working, and that is part of our response plan.
Olivier, do you have a follow-up?
Yes. With the measures that are being taken in long-term care homes, Premier saying that you'll fight this virus in Northwood, for example. Can you, at this moment, guarantee Nova Scotians that what we're seeing in Quebec, loads of cases in these facilities and deaths, won't be happening here?
I can tell you that we're doing everything humanly possible to ensure that we provide the appropriate support to the workers and protect those residents. And we, under the leadership of Dr. Strang and Public Health, pulled together our partners to ensure that we wrap our arms around Northwood to provide them with the support to be able to control, contain, and get rid of this virus.
Next question will go to Chris Halef with News 95.7.
Thank you. This first question is for Dr. Strang. Braemar Superstore has now been closed on 3 different occasions because an employee has been diagnosed with COVID-19. NSHA warned of a possible exposure at the Giant Tiger store on Woodlawn, and the Bedford Superstore was closed down late last month after an employee tested positive. I'm just wondering, are we doing enough to protect employees and the public who are going to the grocery store every week? And if not, what more can and should be done?
So this question came up, whether it was from you or somebody else, the exact same question in the last couple of days. My answer remains the same. I certainly, and many businesses that remain open, grocery stores, pharmacies, they are doing everything they can to adhere to the needs around minimizing numbers at any one time in their store, keeping people, apart from each other, obeying the social distancing rules. Making sure that that their staff are protected, whether it's potentially plexiglass at a counter, a number of steps that they're taking. We support them if there is a worker that is exposed, and public health is there, and we give advice and support the workplace and appropriate actions. And they may go further. We generally don't or ask that a workplace close down, but a number of them have temporarily, just so they can do thorough cleaning, and that's fine if they want to go beyond our recommendations. The third piece is that we need the public to be involved in this. It comes back to the message: what do we all need to do to keep each other safe? So what are we doing to be responsible shoppers? Are we minimizing our shopping? Do we only have one person going shopping? If we do go shopping, what do we do to make sure that we're staying 6 feet apart, that we're not crowding outside of a store in lineups? So your question highlights what can businesses do and how do we support them? But there's also a challenge in there. What do we as citizens do to make sure that that we are keeping those shopping environments safe for ourselves and for others?
Chris, do you have a follow-up?
I do. This question's for the Premier. Obviously, the federal government and the province have imposed measures aimed at helping small businesses during the pandemic. But I'm just wondering, has there been any discussions and thought as to what will be done post-pandemic? Because obviously, many of the decisions being made now will impact businesses and the economy then. I'm just wondering what strategies, if any, have already been discussed.
Well, part of what you're seeing now is try to stabilize some of these businesses that have been forced to close so that they'll still be here when we find our way through this pandemic. That's part of the national government's support in and around the wage supplements they talked about. I was pleased to see, as I said earlier in one of the questions, them come forward with rent deferral program on the commercial leasing side. That's an important thing, and particularly for the Restaurant Association, small business in this province. They'll be critical. It's imperative that gets passed on down to each of the small businesses in the province. But we are now, as I said, we're focused on public health, but we have put our mind to what are some of the steps that will be required to slowly move and transition our economy. And we'll have more to say to that the closer we get. What I really want Nova Scotians to stay focused on is following the public health protocols, self-isolating, washing your hands, keeping the 6-foot distance. It's absolutely critical. I know the weather's nice. I know we all want this to be over with. No one wants it over with more than me, trust me. But we can't give in now. We can't quit now. We can't take our eye off the ball, and we can't take our eye off the goal line. And we need to make sure that we follow public health protocols so that we end up controlling this virus, and then we'll all be able to then open up the economy and get back to some level of normalcy in our lives.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. Yeah, this is a question for Dr. Strang. At least one nursing home has stipulated that staff wear full PPE, personal protective equipment, when caring for a resident with COVID. I don't believe that's part of the directives that the province has issued for long-term care, but given the spike in cases, should that be considered? Is it feasible?
So we as was announced on Monday, it was actually implemented throughout last weekend that we now have in the continuing care sector, both for home care, for residential care facilities and long-term care facilities, any staff, frontline staff doing care need to wear a mask throughout their shift, and that is simply because of what we know now about asymptomatic or mildly symptomatic spread, that people wearing a mask when they may be spreading and not even, or maybe infectious and not even realizing it, minimizes the chance for them to spread to their coworkers or to residents. If people who are actually providing care for individuals who are known to be infected with COVID-19, there are higher levels of personal protective equipment, infection control measures, all of which are being well outlined both in the acute care sector, our hospitals, and in the long-term care sector and in home care. There is detailed guidance for the higher levels of personal protective equipment as different levels of care are provided for people who are known to be positive with COVID-19.
John, do you have a follow-up?
I do. Thank you. Again, for Dr. Strang, the public health officer in British Columbia has said that the false negative results in COVID testing might be as high as 30% with the current test. I'm not sure if we keep track of that here, but if it's that high, if the false negative rate is that high, does that not raise concerns, particularly when we're talking about testing health care workers? Have we seen that here?
I've not heard that quote from Dr. Henry in British Columbia. That certainly is not something that has been brought forward at our national conversations. I've had a number of conversations with Dr. Hatchett, our virologist here, leading all the testing work, who's an expert in this area. He has never identified that no test is perfect, but he has lots of confidence in the ability of this test, and that he has not raised for me that there's any kind of substantive concern around false negatives.
Next question will go to Lindsay Armstrong at All Nova Scotia.
Thank you. For the Premier, today Trudeau announced $962 million in funding for small businesses that he said have fallen through the cracks. Which Nova Scotia businesses will be supported by this package?
The Prime Minister announced that this morning. Our team will be going through that. I'm not sure where that will fit. I don't know all the details of it.
Lindsay, do you have a follow-up?
Yes, so we've heard from concerned Nova Scotians who are self-employed specifically that currently don't fall under any guidelines, understanding that obviously there needs to be a look at what was presented today. Can you speak to these people who are self-employed and say what support will be coming for them?
Well, it was part of the emergency worker program. The bridge funding that we brought in was specifically targeted towards the self-employed. We knew that the federal government had made changes to the unemployment insurance program that was going to make them eligible, but it would take them a lot longer to qualify. The same it would for those who didn't have enough hours. So that was our funding was specifically targeted actually to that group who were falling through the cracks. I'll get more details of what's happening out of this national program, because we then build hours around it to ensure that we can help leverage some of their money, but quite honestly support those businesses that have been left out. Listen, everyone is feeling the pain of this. It has been challenging for businesses of all sizes across the province, and our goal is to ensure that we have as many of these businesses with the capacity to be able to keep going after we find our way through this pandemic. And the support of the national government is a must, and we think the best strategy for Nova Scotia is then to kind of think, where are the cracks and how can we best fill them?
Next question will go to Tim Biscay at the Halifax Examiner.
Hi, thank you. I have a question for Dr. Strang. Going into this crisis, the hospitals did a really good job of getting people out of intensive care units. I recall that you said it was around 40. They were around 40% occupied. The health authority tells me that there are 120 beds. But there's capacity to increase that to 190 or 200. But the projections that came out this week are frankly, I mean, they're very good. The numbers are really low. Worst case scenario, maybe 35 people in intensive care units. So my question to you is, can we start getting back to doing some of the elective and non-urgent surgery because there's capacity?
So I think that is certainly an issue that the health authority can look at. I think we got to remember that we don't want to start to make changes prematurely. Those modeling things, those are numbers that gives guidance. You can't, they're not numbers that you can hold anybody to in a firm number. I think the point that we know that based on the modeling, that as long as we stay into the scenario where we're having strong adherence to our public health measures, that even though if there is a surge of cases, we should be able to manage those within our people who are hospitalizing in ICU within the existing capacity in the health system. But as I said yesterday, that would stretch us because there's still a lot of other health care needs that need to be met. We have trauma that's going to happen. We have people with cancer or necessary other urgent surgeries that need care. But we have to watch. We have a few more weeks before we can confidently say that we have hit our peak and we're starting to go down. So it is something that needs to be looked at as part of our. We talk a lot about as we need to start thinking about how we start to relax some of the public health measures. But along with that is the folks in the healthcare system who are in charge of delivering health care. How do we start to slowly return things to normal? But we need to make sure we don't do that prematurely and put us in a situation where we start to open up the healthcare system, and all of a sudden we have a surge of COVID-19. So it's a bit premature to start to be doing that, but it's not premature to start thinking about that.
Tim, do you have a follow-up?
I do. It seems that the major concern right now, this week and coming forward, concerns the long-term care facilities. British Columbia and Ontario have prevented workers from going between facilities, but I noticed that Dr. Strang's order from the 11th allows and in fact says it's necessary and so to fully staff some of these facilities. It occurs to me, and talking to folks that work at some of these facilities, that the workers they're working in different places because they can't afford or they aren't offered the opportunity to work in one place. So my question is this crisis in some way aggravated right now because our long-term care facilities have been going on the cheap for so many years and not fully employing people and giving them well-paying jobs, and as a result, they've had to work in multiple facilities.
I mean, as a complex staffing issues. I can't speak to some of the long-term pieces. I do know that as we work in this current situation, clearly the more we can keep staff working in one facility, the better, and that is one of our objectives. But we do know that if we are not in a position to be completely directive on that, like some other provinces, because it's always finding the balance of we need people to be in facilities to provide the necessary care. But one of the key things we have done is that when there's an outbreak, that outbreaks in long-term care always create staffing challenges. We've now said that staff who are identified as close contacts, that they can come back and work if they test negative, or they wear masks, their temperatures are checked every day, there's strict protocols for them, and that is simply as a way to make sure that as much as possible, people who work in those facilities can continue to work in those facilities, minimize the need to bring people from other facilities, because we recognize people moving across facilities working is always a chance to spread the virus. So we're doing what we can do within some of the limitations of our HR issues in the long-term care sector to keep people in one facility.
The next question will go to Kyle Shaw with the Coast.
Thanks, Chrissy. Dr. Strang, you spoke at the start of the briefing about some inconsistencies around the long-term care facility statistics. Is that referring to what seems to be an error in today's announcement about new cases, where there are 33 new cases identified just in long-term care facilities, and yet somehow only 27 new cases in the whole province?
So sorry, I know it's 13. There are 13 new cases. Let me look at my numbers here, but there's not 33. You may be doing the math. As of today, there's 55 cases. I don't have yesterday's number in front of us, but there's not 33 new cases in long-term care.
Well, yesterday's number has 23 staff. Today's number has 43 staff cases. Yesterday's residence was 42, and it is 55. So that's 33.
So as I said, the numbers from today are, you can't completely. Today was it was the first day we started giving numbers. We've already finding some errors in how we were getting the data coming to us. So you have a little bit of patience with us. We're working through a process. Both, as I said, are long-term care, home care. They are complex, sectors that while we have a lot of facilities working day and night to deal with COVID, we're asking them to report numbers to us, and so we're trying to create efficient. But also accurate ways to collect that number and kind of roll it all up and report it provincially. So we're in the process of doing that, and we're refining that process. So there is going to be some errors, some inconsistencies in the first little bit as we get this up and going.
Kyle, do you have a follow-up?
Yeah. Speaking of stats, so in light of the dramatic overrepresentation we're seeing of COVID among racialized communities in the United States, is the province able to commit to collecting health data that accounts for race?
So I'm aware there's been a long-standing conversation within the health system, working with the African Nova Scotian communities around that. What it requires is because you actually have to attach having an individual willing to have a cultural or racial identifier attached to their health card number. So there are ongoing discussions with the African Nova Scotian community about the willingness. That would be something that community and ultimately individuals would have to consent to. We're well aware of that issue, and there are conversations that are moving forward. I would suggest in the midst of this COVID-19 that's an issue that's going to have to take a little bit on the back burner, but it's something that will not get lost as we move out of COVID-19.
That's all the time that we have today for questions. Go ahead, Premier.
Thank you, Chrissy. We've just come through 5 weeks of COVID-19, and these 5 weeks have been hard on all of us. But for some families in Nova Scotia, so much worse. Some have lost a loved one. Others are unable to be there in person for loved ones who are fighting COVID-19. Hard to fathom that if your loved one is sick, you can't be beside them to hold their hand. Hard to fathom that another family in Nova Scotia has lost a loved one. And it's hard to fathom that this disease is still here 5 weeks later. There's nothing I would like more than to vanquish this virus. But we don't have a superpower. The only powers that we have is the powers to follow protocols. Wash your hands, keep your distance, and please stay inside as much as possible. I hope you all have a great weekend. Dr. Strang and I will be back here on Monday. Please love each other. Support each other, and I know it's getting harder and harder to follow these health protocols. But if we want to win, we got to play by the rules. So hang in there, follow the rules, and we can beat this thing together.